Good morning, good afternoon, good evening, depending on what time you're watching us or you're watching this video. I'm so grateful to see you again this day. We are here with Talking Hands, Listening Eyes, talking on postpartum depression of deaf moms. And we are so grateful that you take your time to follow us and to watch us. We are so happy. Now, statistics show that 1 out of 7 women suffer from postpartum depression after giving birth. And I know we've been talking about postpartum depression in different angles. And today I have one of us who is a medical person. She'll explain more about herself. And she's here to enlighten us on different stages of postpartum depression and even the different ways of mothers walk through the motherhood journey. And I'm here with Elizabeth Njoroge, who is a doula. She'll tell us more about herself. She'll tell us who a doula is, because in the past I have thought a doula is a different person from now what I hear today. So she'll explain more to us and help us learn more about a doula. Welcome, Liz.
Thank you.
Yes.
Hi, people. My name is Elizabeth Njoroge. I'm a nurse by profession, but dealing with doula. Doula is can be medical or non-medical. A doula deals with mothers before pregnancy, during pregnancy, and after delivery. So he just walks with the mother through the antenatalhood. If the mother can decide, I need a doula before pregnancy, I need a doula during pregnancy, and most of all, after delivery. Yes.
So you can decide to consult a doula even when you're pregnant?
Yes.
That's what you tell us.
You can decide to consult a doula in pregnancy.
Okay. Now tell us, in your line of work, have you ever met a deaf mom? And in case you met one, how would your interaction be with her, especially that you don't know sign language?
Unfortunately or fortunately, I have not met a deaf mom who is pregnant. That has not exposed me so much to dealing with a deaf antenatal mother. But I have seen a gap, because antenatal mothers can be deaf or can be the women that can listen and talk. So I've not met one, but I would think if I would meet one, I think I would have gaps in dealing with that lady. But I am sure that we'll need to think about that deaf woman who is pregnant.
Okay.
Yes.
Communication is a major barrier to the deaf people in getting information. And we've seen this because if today I'm in a matatu and there's a talk somewhere about maternal health or maternal how mothers give birth, I can hear that from from that point. I can be even doing my own things and listen to a video somewhere talking about the journey of the motherhood journey. You can even be here walking to the market, you get 2 women or women talking about it. So for the hearing moms, information is all over. But imagine of a deaf person who comes to you, and this mother is in labor pains, so that one, she's not even concentrating much, and she needs your services. Where would you start?
Labor, you can lead it from just seeing a woman. Thank God, if you are a health provider who is being trained, you can tell a mother who is in labor. What I would do is I would try to get the signs by looking at this woman. But I'm sure we would need to get somebody to interpret whatever this lady is going through, even in those health facilities. But as a woman comes in and I realize she cannot be able to hear, I would try and read the signs and try and help where I can.
Normally, in such a scenario, a hearing mom, even if they have closed their eyes, even if they are focusing on their pain or on their baby, they can hear you tell, especially when you get to this point of push, they can clearly hear you telling them, even if they're not really focusing on you. But how would you help a deaf mom who is in labor pain, and at that point, they can't, you can't communicate with them. So there's that gap, as you said, there's that gap of you communicating. But imagine you're in the delivery room together and the time for pushing has come and you can't tell her to push.
What I would do is that I would try and tell the mother to look at me. And I try to tell her to, okay, for labor, it comes with rhythms. It is systematic. There is a point that you come and then it continues, so we can be able to tell whether the mother is progressing or not.
Okay.
But what I would do is that I would try and address that woman from what I'm seeing. If she's getting the urge or whatever the lady is going through, I can be able to read that from. But I can tell her through like breathing, you know, that one she can read. But I can still assure you that we need somebody or health professions need to introduce something, sign language, for a mother who can come in needing that help and you don't know how to communicate. There's a gap still.
Okay. Now, is it possible to know if a mom can get a postpartum depression when they're giving birth? Is it possible to know that?
Most of the times, it's a no. Because most of the times, when we hear about postnatal depression, during delivery, the delivery can cause postnatal depression, a traumatic delivery. And after delivery, you know, when you're delivering and after delivery, then you get issues after delivery. If it's a traumatic delivery, then the mother may get to postnatal depression.
Okay.
After delivery, if she's not taken care of, she can get postnatal depression.
Oh, yeah, I have asked whether it's possible for you to know whether a mother can get a postpartum depression around that time, and you've explained it well. But I wanted to find out, what would you wish a deaf mom would know, or even before they meet a doula, or as they go to meet a doula, what would you wish they know?
Okay, what I would wish them to know is that I wish they would know what it means to go into labor. They have some basic information. This is what you are expecting. So that even when she comes and she's not maybe able to communicate, she knows that she needs to go to hospital after this and this happens. So when she has that basic information about labor and delivery, she would be able to run to a hospital. And when she gets there, she would know whether she needs to rush, or she needs to wait, or she needs to get care immediately.
Okay, and still on that same question, what would you wish a doula knows before they meet a deaf mom?
I would wish a doula would have basic sign language.
Okay.
Basic, just to know that this lady is in labor.
Yes.
Or just when the mother just tries to explain, you can get something.
Yes.
Yeah, because if you don't get something, then you cannot be able to communicate.
Okay, so you'd wish as many doulas as possible to learn sign language.
Some basic sign
language. Basic, yes, that's very true. Do you think mishandling of a deaf mom or any mom here during childbirth would make them get a postpartum depression?
Yes, that is in fact, delivery is something that is very important to that mother. You can have a very safe antenatalhood, but during delivery, if you are mishandled, it can contribute to postnatal depression. Just because that pain does not go, that it takes a while. So if you are mishandled during delivery, then it is very possible to get postnatal depression.
Dealing with the deaf moms, we've realized that one of their major issue is how they are handled.
Yes.
Number one is because even the health workers or the nurses or even the doulas don't know how to handle them, which is true, because sometimes they may be too overly sensitive, where you feel like you are invading into my space. Sometimes you feel like the deaf people are clueless, and you may find this is a second, third born, but the health workers on the other end may feel like these people are clueless. Sometimes they are clueless because this would be their first baby.
Yeah.
So within that misunderstanding and miscommunication, you find both of them, even if a deaf mom is trying to explain a point, this, whoever, the health worker, the doula, or even the nurses themselves, or even the doctors, sometimes misinterpret. They see like they are overreacting. And I have had this with many people, thinking that the deaf people get angry very fast. Sometimes we think that the deaf people don't reason out like the hearing moms. But what would be your advice to both the health workers and even the deaf moms? The expectations, how do you want to cut the expectations of both, or to manage the expectations?
I would think that if I would know that there is a deaf mother who is coming to a facility, I would want to at least have a specific nurse or a specific health provider or a doula who is dealing with these deaf mothers. That way they can be able to connect and be able to answer all those questions. Because each and every other person has a special or specific, you go through your labor, because your labor may be different, mine may be different. It may be short, it may be painful. Everyone has your own labor. So you may think that this woman is overreacting, but yet that is what she's feeling. So I would recommend at least we would have health providers who are trained or who are specific on deaf mothers, who are trained on sign language and dealing with deaf mothers. That way, through the antenatal, they can connect, they can be able to agree on some issues, or be able to communicate. Because as you learn through the journey of pregnancy, you are able to learn each other. You're able to know this woman when she's angry, when she's unwell, when she's all these things. So I would recommend a specific clinic, specific health providers who are able to deal with deaf mothers. That way they can prevent all this. Yes.
You and me agree that there's a gap, as you said earlier. There's a gap, and this is a communication gap between the hearing world, I would call it that way, and between the deaf world. And more so between the health workers and the deaf moms who visit them. Because here we are talking about, because of communication barriers, you find that the gaps are widened. Because this one can't understand what the other one wants, or vice versa. But now, from here, what would you advise? What would you say that this is my way forward? What would you want done as a way forward by hospitals, by health workers themselves, and even for the deaf moms?
First thing first, because like I said before, if a doula would have the basic training in sign language, that would really help. Yes. The other one would be if sign language would be introduced in healthcare, any training. Training,
like medical
training,
colleges.
Yes. If it can be introduced, then as the nurse is being trained, having basic training on sign language could help this mother, because we cannot eliminate them. Yes. The other one would be if a facility is handling deaf women, let's have follow-up in the homes. That one would prevent postnatal depression. We have community health workers who can follow them at homes, or even in that facility. We can get social workers who can be able to follow these mothers at home. That way would bridge the gap.
Okay. I would say that you've given us a very huge point, especially of follow-ups from the hospital to homes. I've realized that most of the times for the clinics, especially the clinics, they go in, they take maybe a break of 1 month. So if I was here on 25th, I'll come back again on 25th. And in between, something may happen that needs a follow-up, as you say. And sometimes if the nurse most of the times it happens that the nurse, because of their schedules, you go back, you're a deaf mom, you can't really explain. In between now and then, there was a challenge. So I felt I need to come back even before my date is, my due date is here. So how would you help in such a space where the nurses may feel like they need to first listen to the deaf moms more before they, like, you know, you're supposed to come on this date before they even listen, because that's what happens mostly.
Most of the times, what I would think would help is that when a mother delivers and goes home, what I was saying is community health workers, you know, they make regular visits to that home. So they would realize or note if there is any problem that this mother needs to go to the hospital.
Yes.
And if the appointment is not yet or has not come to be, that lady, that community health worker can pick it up, that this mother needs to go to the hospital. So when they go or they accompany each other to the hospital, the nurse or the health provider who is at the facility will not have issues. Why have you come back? Because the community health worker or the social worker can be able to explain this and this is happening.
Yes.
So as we train the health providers, we also need to think about the social worker who can be able to communicate to with the deaf mother and bring in the issue to the facility. So follow-up is done. It's done.
Yes. Okay. So I think this is what fails us mostly, and because sometimes it's out of ignorance, out of we don't know it. Sometimes it's they will figure it out when they get there, you know. But I'm wishing that even these health facilities where we have trained nurses, I would urge them more to have more passion about this, to be intentional, I would say, that because I know we have some trained health workers in very many hospitals. You'll find I learned sign language, but I kept it there. From where I learned, that's where I left it. So I don't know whether we should create more awareness, or what should we do to make them more intentional in serving the deaf people. What would you like would be your overview about those who have learned? Because we have many who have learned sign language, but they're not using it towards the deaf people, especially the deaf moms. Reason, they're there. I went for school, I was paid for. Sometimes you're paid for by the health facility, but you don't practice. How would you advise, or what would be your advice on this? My recommendation would be, in that health facility, there are usually nurses who are specifically put in the antenatal clinics. That is maternal child health. So that we would recommend that one person or one nurse or two would be trained in sign language. That we don't have to look for that other nurse who is out there, who has no passion in antenatalhood or in maternal child health. So train that person who specifically works in maternal child health in sign language. So that she can be passionate even in dealing with the deaf woman as she is passionate in dealing with every other antenatal woman. Okay. Now, because in all this, we are focusing more on mental health of deaf moms, because all this is about mental health. Because when a baby is unwell, when the mother is unwell, and in all this, it is a big gap for them, because sometimes I have seen it that if a mother is not okay, she's not able to breastfeed the baby. Or when the baby is sick there, the baby will not feed, and the mother is here, goes with a lot of milk here, she doesn't know what to do. Again, it becomes a bigger problem. So as you say, we need to bridge this gap, and we need to know, even the health workers to know that the deaf moms are like just any other moms. They just need a special, maybe not even special, a little more patience more than the other moms, because of the communication barriers, the things that we think they know. Sometimes they have no clue. I remember one mom I told that her baby was sick and she needed to go to the hospital. Not even to go, because it was in the middle of the night. She needed just to give first aid, and I was far from her. And I told her, remove her clothes, and because the baby had fever, and just wipe her and remove her clothes, leave her with a vest. She texted me back, what's a vest? And then you're there wondering, how do I explain? How do I explain? I had to take a photo of my baby's vest and send her. So you can imagine the little things you think they know, sometimes they don't know. Because of that, we said about the communication barriers. So even as the nurses, the doctors, the health workers, even the doulas, as they help them know that sometimes it's not they're ignorant, sometimes they have no clue about it. So as we take care of them, as we think about their mental health, as we think about even the journey of motherhood, we need to know that we need to be a little bit patient and even confirming whatever I said, did she get it right? Because again, that's another thing. Just tell me something and move on without even knowing whether has that thing sunk into you. Have you understood it? Have you gotten it right? So now tell me, with all that overview, what would you think, what would you say to all of us, especially the health workers, like you are parting short about taking care about the deaf moms?
I would say a deaf mother should be taken care of specifically, with special care. Because we may think that we have given too much, but there's not too much. There is never too much for a deaf mother. Think of that mother as somebody who needs all the information that you feel that she needs to know about a baby, about delivery, about all these things. When she gets pregnant, I think we should start from there. When she's pregnant, you start teaching her this and this and this and this. And that is why we are saying we need somebody to work with her in the community, in the health facility, and the continuous follow-up. And let the health providers know that there is that special need for that mother. When you treat her in an odd way, you may cause her to get a postnatal depression, which we are trying to prevent now.
Yes.
So may the health workers, or may God help us, be able to deal with these mothers in a special way.
Thank you. Thank you very much, Liz. And I think we have learned, number one, I didn't know who A Doula is. I thought A Doula is a midwife. In fact, I was thinking A Doula is a midwife, just giving birth issues, and that's all. But now I've gotten it. I have gotten a different view of it. And I'm happy that we've had you. And I think we'll keep consulting you more, especially this motherhood journey, before birth and even after birth, because I think that's where the whole gap is. Because these are the things we can figure them out. But when I'm pregnant, what should I eat? What should I not eat? What should I do? How should I, if the baby kicks, what should I do? You know, those.
What are the signs of labor?
Yes.
How should I manage a sick baby? What should I have in the house? What shouldn't I have?
Very true. Well, even that point, and I know there's a confusing question that at what point should I go to the hospital? When you're pregnant, at what point should I go to the hospital? What do I expect when I go to the hospital? Or in between, what should be a danger sign for me to know now here, I need to be more active, I need to do something extra. So in all this, I think I've learned, and I know we'll continue doing more of this, and educating and informing and equipping each other on this motherhood journey. I'm so grateful, and God bless you. When we call you again, please be available.
Anytime.
Yeah. Do you have any parting word that you'd want to say? Tell us if you have something you'd want to say as you're parting short.
Okay, this is my passion, dealing with antenatal mothers. If you're out there and you feel like you really need help, we are out here. We can be able to help. Through this organization, we can be able to deal with any other woman just to prevent postnatal depression. We know it can get anyone. Whether you are deaf or not, it can get you. But we want to deal with this woman who feels like she's alone. She doesn't have anyone to reach to, but we are here to reach you. So antenatalhood should be the pride of every woman, and we should enjoy pregnancy and delivery and have the joy of having a baby as a blessing. So feel welcome to contact us, and we'll be able to answer all those questions that you may be having.
Thank you very much. We are so grateful that about this session. We are so passionate about walking this motherhood journey with the deaf moms, and we may not have solved so many other problems, but our focus is on their mental health and the wellness of their babies, because that's where the whole life starts. And In case you may want to reach us, you may need, we are on social media. We are on Instagram as Talking Hands, Listening Eyes on Postpartum Depression. We call it THLEP, THLEP. We have an email where you can send any question, any inquiry on THLEP, thlep.org20@gmail.com. We also have a phone number where you can do a WhatsApp, you can do a call on 0769 811 399. We are also on Facebook as THLEP, THLEP. Like our page, follow us, and you'll get to learn more about deaf moms on maternal health, and even on any other question that you may have to ask us. And not only for the deaf moms, even the hearing moms, you may come to learn so much from our page and from us. And God bless you. Thank you.